I'm Dr. Darria Long-Gillespie, and I'm ShareCare's SVP of Clinical Strategy. Today we're taking advantage of the new Facebook Live feature to answer your questions about health. So our first question we have from one of our readers is, how can I keep my family safe this summer? Now, I'm an emergency room doctor and I'm a mom, so you know that this is a topic near and dear to my heart. So we're going to talk about three big issues today when it comes to summer safety. Number one is pool and water safety and drowning. Now, drowning is the leading cause of death in children ages 1 to 4 years of age. So anybody who has a child in that age range or knows and loves one needs to hear this next story. I will never forget working an emergency room shift one holiday weekend a few years back, and a family came in. Now, it was Memorial Day weekend, everybody was there, the family was barbecuing, the grandchildren were running around. They sat down for their meal and they realized that they couldn't find one of the grandchildren. They went around, they looked, they started to get nervous because they knew something was wrong, and they found him at the bottom of the hot tub. Now, I tell you this not because I want to scare you. I want you to have a wonderful summer, and I don't want you to see me or any of my emergency room colleagues. I tell you this because I want your family to be safe. So when it comes to summer safety, number one, most important if you have a kid, especially in the ages 1 to 4, you've got to focus on pool and water safety. So I have what I call triple layer protection that I want you to do anytime you and your family are around a body of water or if you have a pool. Number one in the triple layer protection is have a circumferential fence the entire way around the pool. According to the CDC and the AAP, a wall of a house is not enough. You really need a 4-sided fence around that pool. Number two is put an alarm on that fence. So that if anybody opens that gate, the alarm goes off and it alerts people. And number three is especially any time that you have multiple children over or family and a bunch of kids running around, designate an adult as the designated pool watcher. Now, it's not a very fun role. You just have to stand there. You can't do anything else. You're watching the pool. So I say put people on shifts, so you always know who's watching the pool and you can prevent these kinds of things from happening. The next summer injury that I want to talk about, and I know you would probably never think about this, is bouncy houses. 31 children a day are injured and brought to the emergency department because of bouncy houses. Now, I love them. My family had a corporate party recently and they had a bouncy house. Now, if you don't know what a bouncy house is, it's those big air-filled, almost like trampoline-like things with walls and a roof, and they're usually powered by some sort of thing propelling air into it, and you can go in and act like you're 3 years old. It makes you feel like you're weightless. Children love it, adults love it, we all love it. And I know you're thinking, how can that be dangerous? But indeed, it can be. But they're also a lot of fun. So if you follow these 3 tips, you will make sure that you can keep your family safe and you can enjoy the bouncy houses. Number one, a lot of people don't realize when they're installing a bouncy house that if a bunch of people push towards the side, the bouncy house can start to collapse that way and can go far to any one side. So keep at least an 8-foot distance from anything hard, columns, porch patios, trees, anything that if somebody bounces a little bit towards the edge of the bouncy house, they don't hit it. Number two is really important, is making sure that you don't have too many kids or adults, because we've seen adults get injured from these as well, in the bouncy house at the same time. Too many kids makes it more likely that you'll get stepped on or bumped or hit your heads or anything together. Lastly is pay attention to the difference in size, because that's another reason that we see a lot of injuries in the bouncy house. You have a big kid and you have a very little kid, or you have an adult and you have a child. If somebody's over 20 pounds or so difference, I tell them not to be in the bouncy house at the same time, unless you're a bunch of adults, but make sure that you keep people about the same size. That sometimes means that you have different shifts, and the little kids go in for 10 minutes, and then the big kids go in for 10 minutes, and then maybe the adults get to go in, because I know adults need time in the bouncy house too. But that's going to keep everybody safer and reduce your risks of injuries. Now, lastly, I don't know where you are, but here in Atlanta, or Hotlanta, it is getting hot. And in just a few weeks, I'm going to be working in the medical tent at the Atlanta Peachtree Road Race, which is one of the world's very largest road races. One thing we see a lot there are the effects of sun poisoning and heat stroke. So I want to keep you safe just as I'll be taking care of people on that day. It's important to talk about the difference between sun poisoning and heat stroke. Now, sun poisoning is something that a lot of us have probably had over time, and that includes things like a sunburn or just dehydration, a little bit of mild overheating, maybe having some heat cramps, and maybe just feeling really tired. And that's different from heat stroke. Heat stroke is a really severe condition. It's a medical emergency because it can lead to death, and it means that somebody is so hot that their body temperature is above 104 degrees. They may be confused, they may be hallucinating, they may have trouble walking, they can even have seizures and blackout. So it's really important that you prevent somebody from getting to that. So how do we do that? For number one, and this is also for parents who have kids playing in sports in the summer, it's really important to pay attention to. What I always tell people to pay attention to is not just the heat, but the heat index, which is a measure of the temperature and the humidity. Pay attention to how much equipment you or your child is going to be wearing. So somebody going out for a run wearing a light t-shirt and some light shorts is one thing. In the exact same temperature, somebody of the exact same age going out for football practice, wearing helmets and heavy pads, the person for football practice is going to overheat much sooner, even if they do the exact same workout in the same temperature. Also, pay attention to your overall conditioning status and your current status. Are you used to that degree of activity? Is your child used to that degree of activity? If so, they're going to be much more able to handle the heat. And lastly is their current status. If you have two kids who have the same physical activity in the same football camp, but one just had a stomach illness 2 days ago and he's been a little dehydrated, not eating and drinking as well, he's not going to be able to handle the heat as well as the one who's been well. So pay attention to those four factors: the heat index, the amount of equipment, their conditioning status, and their health current status, and you'll be able to tell and predict how well your child can handle the heat and dehydration. Some tips to keep them from getting overheated and dehydrated are, of course, make sure they drink plenty of fluids, get them out of the sun, get them into the sun and shade. If you can get them into air conditioning, I say every 1 to 2 hours. I know kids can be tough to get them out from playing, but 1 to 2 hours is a great chance to get them in, get a water break, and cool down. And for kids who are in the 5-year-old age range, you're going to want them to have about 5 to 7 glasses of water a day. Older kids and teens may need 8 to 10 glasses, and if they're getting out really hot and really exerting themselves, they may need up to 50% even more. If they're really exerting themselves and that 50% higher, that's when I suggest starting to give some different electrolyte mixes and things like that, Powerade and Gatorade. Otherwise, you're usually really just okay with water. Now, a couple of things if somebody does overheat. And these are tips that we use in the emergency department. And if you call 911, there are tips that your ambulance will use, but they're things that you can use at home. And I remember working a race one year, again, the medical tent, and people were really overheated. And if you looked and came into the medical tent, you would have laughed to see a row of people. Everybody had the same. We had really cold ice cloths on the back of their necks. If you can, put really cold ice cloths in the area of the groin and under your arms. And then secondly is spray them with light water, not a hose or anything necessarily, but just a mister if you have it, really anything to get them wet, and put them in front of a fan. So if you came into our medical tent that hour, you would have seen 15 people all sitting in front of fans cooling down. It is what we use in the ER to cool people down, and if you're worried that somebody is overheating, is the best tip to get them cool really quickly. So that's my summer safety tips. Let's move on to our next question. So this next question was, what do the new nutrition labels mean when they talk about added sugar? Now you may have heard that the nutrition labels, those same black and white labels we see on the back of all of our foods, are getting a little bit of a facelift. There are some things on there that I think are great, some things that are less helpful, but this added sugar part is something that I'm very glad they're putting in, because it's hard for people to keep track of all the added sugars that you have. You may not even realize yogurts, ketchups, barbecue sauce, salad dressing, all of them have a lot of added sugar. So now your foods and nutrition labels will show you. Now, I'm not telling you to avoid all sugars in the forms of whole foods. If you're eating a fruit or a papaya, that has sugar too, but that is not an added sugar, and that's okay. I'm not telling you to avoid those. I'm talking about the added sugar. Now, we're talking about high fructose corn syrup, but to be honest, high fructose corn syrup gets a lot of attention, but it's all the syrups, all the corn sugars, corn sugar, cane sugar, corn syrup, anything ending with an ose, treat all of them the same way. They are added sugar. They are all pretty equally bad for you, and you want to minimize them. So for somebody who is, the daily value is about 10% of your calories. So if you are an average woman, maybe your daily value of calories is about 1,300 to 1,500 calories. That means 130 to 150 of your calories is the limit that you should be getting from sugar. So that's about 7 to 8 teaspoons, give or take a little bit from my arithmetic, of sugar in total that you should be eating a day. It's pretty easy to exceed that. So pay attention to it on the nutrition labels. They're going to make that a little bit easier. Now, next question, what can I do to minimize my risk of getting Zika? Zika virus. Oh, this is going to be the concern for a lot of us this summer. And a few months ago it seemed to be an issue of anybody who was traveling to South America, but now it's an issue for all of us. All of us throughout the South are going to have the mosquito that carries Zika virus going to be here, and it's potentially even going up the East Coast. So I was just talking with a friend earlier today, and she wants to be starting to get pregnant, but her husband travels to Brazil a lot for work. So we really had to have a heart-to-heart, and here's the hard truth I had to tell her. Reality for her, if her husband doesn't have any symptoms of Zika, they still have to have protected intercourse for around 6 to 8 weeks, and they can't try to have a child until after that. Now, if he has symptoms of Zika, he needs to be tested, and if he did get Zika, they can't have unprotected intercourse for 6 months. And she really does need to delay that childbearing for 6 months, because you can catch Zika sexually. So Zika is something we're seeing more and more. We're going to be seeing it more and more in the US, as well as from people traveling back from these countries. So what do? There's no vaccine for Zika, and if you've gotten Zika and you're pregnant, there's nothing we can do to lower the risks of microcephaly, which is the really devastating complication that we're seeing from it. So what do? The best thing, the only thing that we have right now is prevention and making sure that you're not bitten by the mosquito in the very first place. So I just wrote a blog on this. Check it out on ShareCare. You will see it on all of our social outlets. But the way to keep this mosquito from biting you, number one, is prevent it from being around your house. So I've learned a whole lot more about mosquitoes than I ever really knew I wanted to in the last couple of months. But mosquitoes love to lay eggs in bodies of water. Think potted plants, even if you old tires sitting around, or that little extra baby toddler pool that you have. And they'll lay their eggs along the walls. So to get rid of the eggs, you don't just need to pour out the bucket or the pool or anything else. You have to scrub the eggs off of those walls to really get rid of them. So once a week, dump out any containers of water that you have in or outside of your home, because you don't want mosquitoes inside either, and get rid of that chance that they have to be laying eggs there and reproducing. Number two is repellent. This is crucial, and I don't like to put more toxins on my body any more than the rest of us, but repellent is a place we have to do it this summer because the risk of Zika is so great. So what are some of the key repellents you'll probably be hearing? You have no doubt heard of DEET. Now DEET you want to stick to about, when you're talking about kids, and stick to about 10 to 20%. The AAP, the American Academy of Pediatrics, recommends under 30%. And 10%, the percentage is important because it's for how long it will be effective. So 10% DEET will be effective for about 2 hours. Around 24% DEET will be effective for about 5 hours. So it's a great option. There's another repellent that you can put on your skin, just like DEET, and that's called picaridin. Picaridin, look for about 20% to have the same efficacy as DEET. And then there's another one called permethrin. Now permethrin you don't put on your skin, you put on your clothing. And it's going to keep the mosquitoes from biting you through your clothing. So what's the very best protection is to put on permethrin-treated clothing. This is what I will be doing, and this is what I advise any woman who is considering starting a family and her spouse the next few months. Permethrin-treated clothing, and then DEET or picaridin on any exposed skin. And do the same thing for kids if you have it. Permethrin-treated clothing and then DEET or picaridin on any exposed skin. Or you can even spray those a little bit on clothing if it's cotton or something that won't be damaged by DEET. Of course, as soon as you come in, wash off all that repellent so that you make sure that you don't wear it, you're not exposed to it any more than you have to be. And don't use a sunscreen combined with DEET, because you'll end up using probably too much DEET. And you need to reapply your sunscreen, which will definitely end up getting excess more than you need. And when it comes to repellents for kids under 2 months of age, you don't want to use DEET on them. For them, if you're going out with a stroller, use a mosquito netting. And those ways you'll be able to take some steps to keep your family safe from mosquitoes. Enjoy the summer, because who wants Zika to ruin our summer? And have a great summer and stay safe the whole time. This is Dr. Darria for Share.